Pregnancy is hard enough without dealing with this as well. Welcome to Ms. Mojo, and today we're counting down our picks for the top 5 facts about Hyperemesis Gravidarum. Before we begin, we publish new videos every day, so be sure to subscribe for more great content. For this list, we're looking at the most salient facts about this illness, which has affected Kate Middleton during her past pregnancies. Number 5. It affects up to 2% of pregnant women. Most pregnant women deal with some level of morning sickness, but Hyperemesis gravidarum is actually pretty uncommon. Numbers vary as to how many women it actually affects. The Duchess of Cambridge suffered from the disease, more often referred to as extreme morning sickness, during her first 2 pregnancies. If a woman experiences it during one pregnancy, it does not mean it will happen to her for all subsequent pregnancies, but going on recent news reports, it seems that unfortunately Kate is having the same issues with her 3rd child that she did with her first 2. Number 4. There are factors making you more at risk of having Hyperemesis gravidarum. During Kate's first pregnancy, which the royal family announced at the end of 2012, there was much speculation that she might be carrying twins. One of the factors fueling this rumor was the fact that Hyperemesis gravidarum is actually much more common if you're expecting multiple births. There isn't necessarily concrete evidence that the condition is hereditary, but it does sometimes seem to occur more frequently in women whose mothers also suffered from it. If you're someone who typically deals with motion sickness, you also might be more likely to have these symptoms. Number 3. Medication can help. Scientific research on Hyperemesis gravidarum is still relatively new, and not long ago medical professionals actually considered it to be a psychological condition. Luckily, medications have been developed to treat it. Diclegis and Zofran are 2 commonly prescribed drugs for women suffering from Hyperemesis gravidarum, which are meant to temper the feelings of nausea that accompany it. Many women worry about taking medications while pregnant due to the adverse side effects, but if your symptoms are so bad that you can't eat, the fetus can also be harmed from a lack of nourishment. Another symptom of the condition is dehydration, so in extreme cases, women might have to be given fluids intravenously. Number 2. The fetus is probably fine.
It's amazing, a 3-ounce fetus is calling the shots. It's so badass.
When pregnant women begin experiencing extreme symptoms, it's likely that their first thought is that something might be wrong with their baby. Luckily, having Hyperemesis gravidarum is not inherently dangerous for your fetus. Though it's always prudent to visit a health professional if your symptoms are worrisome, you can avoid being overly concerned about the health of your baby. Mothers with Hyperemesis gravidarum tend to have babies who develop normally and are an average weight. They can sometimes even be above average. Number 1. It's not just bad morning sickness. The biggest misconception about Hyperemesis gravidarum is that it's simply extreme morning sickness.
This is morning sickness like a tornado is a little wind.
Because the name of the disease is not well known, it's often referred to as acute morning sickness or severe morning sickness. People experiencing this condition may become frustrated when their constant vomiting, extreme weight loss, and liver dysfunction are chalked up to simply being a particularly difficult version of what most pregnant women experience. Hyperemesis gravidarum is something caused by elevated hormone levels that is diagnosed by a doctor after ruling out other options.
And so along that spectrum, we encourage women to reach out for help, talk to their provider, because there are treatment options available.
Do you agree with our picks? Check out these other great clips from Ms. Mojo and subscribe for new videos every day.